So this is a part of Sipher's sixth anniversary that we are presenting models in tobacco control enforcement of India tobacco nicotine laws. And Mr. Saju V.T. will present experiences in implementation of laws from Kerala. So it is my great honor to welcome Dr. Haresh Chandwani, a pioneering public health scientist dedicated to the NCD prevention and policy research. We also extend a warm welcome to Mr. Saju V.T., a passionate advocate for tobacco control, women's empowerment, and social change. We also welcome Dr. Sanchika Gupta and Mr. Manna. Sanchika Gupta is from Eco India, and Mr. Manna is our intern from Cypher. So the collective efforts of Dr. Haresh and Mr. Sajju in research, policy implementation, and advocacy have led to groundbreaking interventions in public health. We look forward to gaining valuable insights from their experiences and expertise. We also welcome all the participants and attendees. Your presence has made this session truly meaningful. We hope the discussions today inspire further actions towards creating a healthier and tobacco-free future. So we'll listen to Dr. Haresh Chandwani, who is the General Manager of Eco India. He has served as an assistant and associate professor in various medical colleges and has been a public health consultant in urban health division and the government of Gujarat. He was also the assistant director with the Gujarat State AIDS Control Society. He has, to his credit, publications in various national and international journals and has been involved in evaluation of various national health programs. So, Dr. Chandwani, we welcome you and we'll stop sharing the presentation. So, you can say a few words,
Yeah,
the opening
thank you.
remarks about the presentation. Yeah, thank you.
Thank you so much, sir. Thank you. I am truly humbled, and it is truly an honor for me that you have invited me at this forum, and I'm truly delighted and humbled to be a part of this initiative. As you know, we are very much thankful, Echo India, to be partnered with to have collaborated with Cypher, such an eminent organization, and doing such a wonderful work. I would say it's a noble cause, which your team is doing, the Cypher is doing as a whole, to tobacco cessation. Because if in one of the I was attending one conference and one workshop, I don't remember what forum or workshops, they said that if you have to do any good deed, अगर आपको कोई अच्छा कर्मा करना होता है, तो you have to, if even if you help even single person quit tobacco, that would be a good karma. So that is the kind of, sir, you and your team, you are doing this kind of good karma, that, tobacco cessation, because it is one of the biggest menace in during today's time, during today's generation. It has spread a lot of, you know, it is, I think, it is, destroying the youth, today's youth. So the initiatives which you are taking is truly commendable, and please accept my compliments and congratulations for this initiative. And we need to have collective effort. So the kind of topic which you have chosen is very appropriate, very apt, that tobacco enforcement laws, because still there are a lot many Kotpa Act and TOFI, there are a lot many acts are there, but the enforcement implementation is, I feel, is somewhere it's not up to the mark. And because of which, even if there is law on, like there is ban on e-cigarettes, but the youth, the today's generation, they get e-cigarettes from, where the pawn shops and various other locations. So still there are lot many loopholes, lacuna in terms of stringent implementation enforcement laws. So I think we need to, come up with the strategies how we can further strengthen the implementation of laws. So just as we know that India is the second largest producer and consumer of tobacco products. Of course, as per the Global Adult Tobacco Survey, there is prevalence of any form of tobacco use has decreased significantly by 6% from 34.6%, 28.6%, but there is still a long way to go. And as we all know, that every year 1 million people they die due to disease caused by tobacco use in India. And the good part is all these deaths are preventable. And uh, so there is complexity involved in tobacco use. So tobacco use situation in India is complex owing to availability of various forms of tobacco. You have cigarettes, e-cigarettes, you have pan masala, and mawa, whatever you call in various states. So people have access to lot many forms of tobacco, and they have and from very early age they start using it. So I have seen in when I was in, I did my MBBS from Bhavnagar, MD from Jamnagar, so Saurashtra region of Gujarat, in which I was very, you know, I was very taken aback to see that very young boys of, I would say, maybe 10 years, 8 years, they start chewing tobacco at a very such a young age. So, I mean, it pains me a lot when I see such young boys, and not even boys, girls also, they start using tobacco at very young age. So that I think we need to do something about it. And as far as policy implementation is concerned, so we have like laws like cigarette and other tobacco products like COTPA, as we call it. It's crucial for effective implementation tobacco control in India, but I somehow feel that COTPA is a toothless. I mean, I would not say bad, but it's not like very strong act. So I think we need to uh, think about it and how we can come up with very another very stringent law. So uh, there are, as I said, there are key points about the importance of implementation of law, tobacco control. So without robust on enforcement, the minors can easily access tobacco products, leading to increased youth uh, smoking rates. And poor implementation weakens the protection against secondhand smoke in public places, impacting non-smokers' health. There is also advertisement now. It has come up that whenever you watch movie or web series, so there is advertisement that it, smoking causes cancer or whatever. But I think it has made some impact. But despite that OTT is unregulated body over the top the channels, and despite I think there have been several discussions. But despite
Can you
still,
please keep yourself muted? So all non-speakers can keep themselves muted, please. Thank you.
so I have also attended several workshops on how to regulate OTT, and because the kind of uh, uh, the uh, the tobacco products or kind of language that they are using, the kind of the scenes that they are displaying. So it's I think unregulated body, and because of that, and it's easily accessible, these kind of channels, to all the youths. There is no restriction, and despite there is some mechanism that you can your children should not watch this kind of programs, but despite that they have ways and means to access those web series or access those content, and they watch it uh, by anyhow. The point which I'm trying to make is we do have some laws, we do have some regulations, but when it comes to implementation, still there is a lot, there is a long way to go, and a lot needs to be done. So I think with today's speaker's presentation, I think we'll able to. I'm looking forward to it. His experience in Kerala and how we can further strengthen the implementation of laws. So because as I said that if you help any single person in your lifetime to quit tobacco, so that would be a huge achievement for you, for everyone. And if we take the pledge, each one of us who are present here today, that we will help. You will find it in your in your family, in your neighborhood, in your workplace, in your school, colleges, wherever. And you see the lot many and youngsters, they start smoking at very young age, adolescents, and maybe, as I said, I have seen people, boys, young boys and girls, they start chewing tobacco at 8 years, 10 years, 12 years. So that is their that is the childhood which they are destroying, spoiling. So I think we need to uh, you need to make a lot of efforts to make an impact on the ground. And so I wish, thank you, Dr. Rakesh Gupta, sir, and your team for taking up such initiatives, and Dr. Mr. Siju, so for your the efforts. So on that note, I'd like to once again thank Dr. Rakesh Gupta and Sipher team for inviting me, for having me in this forum, and all the participants. Thank you so much for taking out your time, and I wish all of you an learning experience ahead. So I'm looking forward to this session. Thank you so much.
Yeah. So thank you, Dr. Haresh. So we may tell you that we are working on all aspects of the WHO Empower package. So that is monitoring tobacco epidemic, then prevention of secondhand smoking. The O is just a part of it. I mean, we are working on cessation as well. The W is regarding warning against the harms of tobacco. Then E is enforcing taps, that is tobacco advertisement. And R is regarding raising taxes. We are not working much on raising taxes, but on all other packages, we are actually involved. And you know that we are partly responsible for the ends, that is law, PICA 2019, that is Prevention of Electronic Cigarette Act, because we in Punjab, when I was state nodal officer, so we banned electronic cigarettes way back in 2013 under Drugs and Cosmetic Act. And also OTT, you also attended that meeting. So immediately after that, in April, we had that meeting, April 23. And in May, we had a notification regarding uh, OTT, that is tobacco imagery on OTT platforms. So thanks a lot. So we will, and thanks for the support of the Eco India, surely, because they have made our job easier in organizing these online meetings, conferences, etc. So thanks a lot. So
Thank
can you just stay for a minute? We'll have some snapshots of all the participants, please.
Sure,
So
sir.
can all the participants please open up their videos? Open up your cameras, yeah, so that we can have snapshots with Dr. Haresh. So thanks a lot. And
Thank you,
so
sir, and
if,
wish you all
if
the best.
possible, you can just join us after the meeting, and then
Sure.
we'll have your concluding remarks as well. Yeah. Thank you.
Thank you, sir. Thank you so much. Yeah.
Okay. So over to Mr. Saju. So we'll be learning from him because we are still in the learning phase. We need to learn from other states also regarding how they have implemented the laws, right? So Mr. Saju actually, uh, so he is an old champion in tobacco control. Saju Iti is MSW, LLB, Diploma in Journalism, and he is the Executive Director of Kerala Voluntary Health Services. He has been working in this NGO sector since 1992 and one of the pioneer civil society leaders in tobacco control. In his leadership, Kottayam was declared as the second smoke-free jurisdiction in the country way back in 2008. Now Kerala shows high compliance of all sections of CODPA. Apart from this, several best practices like Yellow Line campaign, tobacco-free neighborhoods, etc., were initiated by the Kerala Voluntary Health Services during the last 15 years. Kerala was declared as advertisement-free way back in 2015, that is almost 10 years ago, and they issued a comprehensive 5.3 orders, Article 5.3 under FCTC order in 2019, and Kerala High Court judgment on KVHS public litigation March 2012 pressurized government to draft film rules in July 2012. The PIL filed by KVHS in last year questioned the inaction of government on several violations of CODPA and long delay of notification in some specific sections of Principal Act of CODPA. He conducted several social and environmental impact assessment studies for the government. 9 studies have been published in child rights and 3 on tobacco control. So you're welcome, Sajuiti, and over to you, please.
Thank you, sir. Thank you very much. And thank you, Harish Chandwani. I think because he made a very wonderful introduction and narrated his experience in the tobacco control also. So thank you very much for both of you, and thank you, Ragesh, for inviting me to present our experience in today's webinar. So actually, because this is one of the very informative series of webinar conducted by ECHO for means Ragesh ji and the team last several week. I think because I am so interested for that thing, because it's a interstate learning. It initiated interstate learning, and it's definitely will help the national level, because we could understand each other, and how the each state is coming up, and how it will contributed to India's tobacco control effort and journey. So anyway, means regarding Kerala, as you people know, is the one of the high prevalence state. I mean, better state in regarding the tobacco control effort. Actually, because means why I am saying giving you some demographic details about Kerala is that because it's very closely related with the tobacco control, because our density is very high compared to other part of India, in the sense because apart from cities of India, because Kerala is an urbanized state, actually having a 859 pupils per square meter, because that means the tobacco control is one of the major public health issue. Means tobacco is one of the major public health issue for us, because this much densely populated state, public smoking should not be happened. That is the one of the reason I show the density of the population, and our growth rate is also 3.31, and all other demographic details shows that how important tobacco control in the Kerala settings. That is very much important, because we are showing always all social indicator. It's the best social indicator we are showing in health and social development and that type of things. So along with that thing, we have to be show best in. If you are going for a best in health, we should be very much give importance to tobacco control also, because this is one of the major public health issue, and we have to be show our goodness in tobacco control also. Next slide, sir. Sir, next slide. Yeah. So why I am giving you this age structure and that about things is that 15 to 64 years, 70% of Kerala population is that age. That also giving importance to tobacco control, because this is the potential age for tobacco industry. Always be why tobacco industry is giving much importance to Kerala is that because they have a potential market in the state. That's why we are facing lot of tobacco interference, because 70% of our population is their potential market population. Even the other indicators are there, because the female literacy and female status, because Kerala is one of the best in India. So, but you see, means nowadays we are facing some problem of urbanization, and means this woman empowerment, because they are, means that's why the tobacco companies are also targeting women also. That's the news are coming up. Our IT industry area in the GARD 3 report will shows that how we will control, how effectively we control the woman population to switch to tobacco. So I think because we are very worried about that thing at present. Why I'm showing the religious details is that because religion is not a matter in tobacco control in Kerala, because some religious people are not much in tobacco use. But Kerala, it's that is not very important for Kerala. Next one. Next one, sir. Yeah. So coming to our not the before that one slide is there, sir. Yeah. Kerala is having a ecosystem. I mean, the tobacco control is having an ecosystem. It's needed a ecosystem. So Kerala is having an ecosystem from 1807 onwards, because the first World Tobacco Day was observed in Kerala with a very state level, very huge state level function. And it was inaugurated by the minister, and it was, I think, because our media clippings are with us, it was one of the bigger event happened in 87. That time tobacco control is no more an priority issue in India. 96 to 2006 RCC, Regional Cancer Center, observed tobacco control decade with the support of WHO. So in 1998, Honorable Kerala High Court banned smoking in public places, because that time, means the national level, tobacco control was no more an issue. One biology professor, Monema Kokkat, she was daily traveling in a train, and she faced the problem of public smoking, and she went for a public litigation to Kerala High Court, and Kerala High Court was banned smoking in public places. That was really a revolution happened in Kerala, because immediately government was acted on that. And Kerala, many public places, because the smoking was banned at that time itself. 2002 to 2004, Kerala Voluntary Health Service implemented statewide awareness on hazards of tobacco, WHO support. 2003 to 4, we quit you in campaign. I think many states it conducted, but Kerala also conducted with the WHO support. 2004 to 2006, tobacco control campaign by KVHS with the American Cancer Society. I think because our Rajesh sir from Rajasthan, he knows it very well, because we were one of the pioneer organization in collaboration with the American Cancer Society conducted tobacco control activities. We got a seed grant, and one so means KVHS get a much more experience in that area before means the national level activities come up. Tobacco control campaign by KVHS supported by VHI, VGI grant. That was started in 2007. 2009, tobacco control campaign by onwards, TC campaign by KVHS with the VGI support. 2009 onwards, NDCP means activities are going on in Kerala. 2009. 2011, NDCP was covered by all the districts, because in 2009 it was covered, NDCP started with one district, Calicut. Later it was extended to all the districts. So now I am coming to the milestone. 2007 first case of Section 6B, fine imposed by Vagatana Messenger. You just imagine, in 2006 only Section 6B, Section 6 notification come up from the national level. There was no one working on tobacco control that time. The first case was registered in our police station under Section 6B, because sale of tobacco near the education institution, and it was registered. The fine was collected, and I think that time it was a big news. 2007, just imagine. 2008, Kottayam district declared as the second smoke-free jurisdiction in India. Now we are talking about toffee and a lot of other things. But 2007 itself, we have fining Section 6B. That is very important. 2009, first Section 5 CODPA violation, smoking in film. That was registered in Fort Kochi SHO. Fort Kochi, the first case in Section 5 was registered in Fort Kochi police station. So that's why, means that police officer were honored by Kerala Voluntary Health Services in a state level function in 2009 itself. 2010, because of his case, we went for public litigation in 2010. 2010, LSGB order comes up, local self-government. Issue a order that because all the public places should be smoke free, because now we are talking about tobacco free village, but we have an order in 2010 itself our local body jurisdiction, panchayat, municipal and corporation jurisdictions should be smoke free with the signage. So that time signage was not that much, court pass signage was not very familiar to the public, but at that time it's a local body government, local body department issue an order. Ernakulam and Thiruvananthapuram district declared as tobacco free tourist destination in 2010. District nodal officers notified in 2010. 2011, Iringalakuda Thrissur, of Thrissur district declared as tobacco free education district, because now we are talking about toffee, because Iringalakuda was the first education district in the sense DEO district, education district, means we have within a revenue district, we have 3-4 education districts are there. So Iringalakuda one of our education district under Thrissur district. So that Iringalakuda was declared as tobacco free education district that time. Yellow Lane campaign started in Kottayam and Ernakulam 2011. 2000, that was the first Yellow Lane campaign actually happened. Means it's Yellow Lane campaign, it's started with quite accidental in the sense, because the police was facing a problem with local shop owners every time when they are coming there for enforcing matter. Then we were standing outside the 100 meter, we will be away from 100 meters. So a lot of conflict to happen in the local level, in the grassroots level. That's why we started Yellow Line. 2012, Idiki district declared as the first tobacco-free education institution district. One whole district was declared as 2012. 2012, Honorable Kerala High Court 3-tier system to monitor tobacco use in school. This is a very, very landmark judgment we got in 2012, because Honorable Judge High Court, Kerala High Court told to the government that you should constitute a 3-tier system for monitoring tobacco use. The High Court very clearly says that you should have a school protection committee in the school level. You should have a district level monitoring committee to monitor school monitoring committees. You should have a state level monitoring system for monitoring the district level activities. So it was a very clear judgment, and says that Manjula Chellur, that was that time the judge, Chief Justice, she told the government that every 3 months the progress would be reported to High Court. So that was a very marvelous judgment come out. That's why, and the judgment is very clearly say that you should constitute new committees within 1 month of the whole academic year. So that's why all our schools within one academic means within 1 month means, because normally our school will be opening in the first of June. So it should be constituted within 1 month, in the sense before July 1st, when it's June 30th, you should have a school monitoring committee. So that is a very clear judgment. So SLT banned in 2012, declare Ernakulam tobacco free advertisement district in 2013. Whole district covered by a whole district covered by NDCP. In 2014 onwards, whole 14 district we are covered by NDCP. 2015 declared as tobacco advertisement free state. 2016 Kotpa included in state crime record. That was also a milestone in the Kerala tobacco control, because crime record, the police crime record, the Kotpa was introduced. Actually, because not only Kerala Voluntary Health Service, another organizations were also working for that thing. Kotpa included in the state crime record. All districts shows high compliance on Kotpa. 5.3 order was issued in 2018. Means it was a very comprehensive order. We have a 5.3 order, and we have display of boards in all the collectorates. and state headquarters notified excise inspectors as enforcement officials. That was also one of the major milestone for us, because up to that time excise was out of COTPA enforcement. So because of this notification, excise department, excise in the sense in Kerala, excise department is looking for the alcohol and that type of things. They were also comes to the picture of enforcement of COTPA. 2020 state specific head of account for COTPA fine was introduced. 2010 COTPA in police training module. 2022 COTPA in LSGD leaders training module. So now it is institutionalized. The COTPA training was institutionalized in Kerala, because all the newly elected LSGD leaders should go for training in KILA, Kerala Institute of Local Administration. So that institute is giving training to leaders, local body leaders. Those who are newly elected, if it is a sub-election or a by-election or whatever may be, means once the leader the leader was elected, he should undergo a 15 days training in KILA, Kerala Institute of Local Administration. So that is a must in Kerala for all the local body leaders. So that KILA was already accepted our COTPA module. So all the leaders, newly elected or the old leaders, are getting training on COTPA. So the police training module is also there. So it's institutionalized already, that COTPA training is institutionalized. 2023 Legal Service Authority started to monitor COTPA enforcement. So up to that time, district administration was monitoring the COTPA in the district level by DLCC. But now Legal Service Authority is also monitoring COTPA. 2014-24 tobacco free Ur campaign and neighborhood campaign. Some districts were declared because the campaigns were started little early, but some declarations happened in 2024. So these are our major milestones. Why I show all these things is that nowadays it is a fashion that tobacco control is a ready-made activity. Because many people are claiming that, I heard that, many people are claiming that because it's a ready-made activity like that. It's not possible. I think because when we are thinking about the sustainability of tobacco control, there should be long way we wanted to go. Because then only it will be institutionalized, and means we are working in the tobacco control for the civic sense also, because people should follow the law, people should obey the law, and the enforcement officials to enforce the law. So this is a culture. Tobacco control should be as part of our habit, as part of our practice, as part of our institutionalized system. Then only we could expect a good result on tobacco control. Because why we are going for? It's Kerala. Our aim is to bring the prevalence less than 5% within means 2025-26. So that is our gain. That is our goal. So going for that thing, it's a long way we wanted to go. A 1 day enforcement or a 3 day enforcement or a 1 year enforcement, it is not possible. In the coming data, you will be getting more picture about that thing. So means got data already, I think, because previous slide, sir. 1 second. Yeah. Everybody knows it. GAT 2, because Kerala is one of the best state, shows the best result in GAT 1 and GAT 2, means compared to GAT 1, GAT 2, because we reduce our prevalence from 21.4 to 12.7. It's much difficult. Because now we are facing the problem in GAT 3 is that because 12.7 to 9, it is much difficult than 21.4 to 12.7. Because we are second after Bihar. Because Bihar made a very huge reduction in the GAT 1 and GAT 2. So I think because Kerala second is 21.4 to 12.7. So that is our major achievement. Means happen in that GAT 1 and GAT compared to GAT 1, GAT 2. Anyway, we will be having a, but there are, you see, means use among 15 to 17 year marginal increase was happened. 0.6% increase was happened among the youth. That is our concern, much concern. Next one, sir. Yeah. So this is the police data. Just to show, means why I wanted to show it, that because in 2016, crime means Kotpa was included in the state police crime record. So 2016, you see, means near about 2 lakhs cases, more than 2.5 means lakh cases was fined. But now you just see, this is 2014, how many cases? Of course, in 2020 is the COVID area, 2021 is also COVID, 22 is also somewhat COVID impact is there. But now you see, means the number of cases in the means the police is reduced to 61,000. Where it means it's 61,000. So that's why I'm telling. So only means police is doing better in Kerala, but 2024 the number is marginally reduced. That's why we are criticizing somewhat the police in the sense, because nowadays police is 231,000 cases in 2016. Now it is 2024. So we really frightened that, because somewhere or other means some interference was happened or not. Anyway, we are working for that means along with the police, because the training we are giving SHO training and police training and means that type of things. Newly recruited police is getting training and that type of things are going on. Next one, sir. Yeah. So, but the amount we collected is a fantastic one, because in 2016 and 2000 means number of cases was 2 lakhs in 2016, but the amount collected this 2024 was 1,25,076 means 1,25 lakhs 76,000 rupees we collected as fine. Means section 4 fine is 1,13 lakhs. That itself is a very fantastic one. Section 6A is 77 lakhs 85,000 and section 6B is 4 lakhs 36,000. So our police and SLT worth near about 210 means 21 million means 210 million was seizure by police and that type of things. Means police is doing excellent work, no doubt about that in the enforcement area. Next one. Next, sir. Yeah. Before that, one more slide, sir.
Sajjuji, you want the previous one?
Yeah. Excise.
Is this okay?
Yeah. Excise is doing much better than police, because they got the notification in means of the means enforcement official in 2020 only. That's why it's the better performance is showing there, and we got near about 7 crore rupees. 7 crore rupees as fine. Now, because excise was notified for section 4 and section 6B only. They don't have any other sections notification. That's why both the sections they do it very well, and 7 crore 32. Because I think because Kerala is one of the state is getting a very huge amount of tobacco fine. Means police and excise we are getting near about 10 crore rupees actually, means as fine. That is a very good amount compared to other states, I think. But seizure of 323 million, how much smokeless tobacco is coming to Kerala? That is very important, because that is not because of Kerala is not very prevalent in SLT use. But the problem with Kerala is that we have near about 60 lakh migrant laborers from all over India. So that's why these migrant laborers need SLT. So you see the prevalence of SLT Means that is the major challenge Kerala is facing now, because SLT use and SLT is coming from other states, and SLT is bringing from other states to for the use of the our migrant laborers. It may influence our Keralites also for SLT use. That is the major challenge we will be facing in coming days, coming years. Next one, sir. Health department. See, means NDCP is spending a much amount for the tobacco control. But in the when we are coming for the enforcement, what is happening? Section 4, only 68,000, 68 cases was fined. Section 6, 5 and 5 cases they already taken. But you see, means total amount was only 3,98,800 only as fine. Because this is our health inspectors are doing the much work, means they are doing much work, and but the amount of fine is very limited. But the health department is the nodal agency is working. So why it is happening? Why it is happening in the sense the police is and excise is a uniform force. Health is not a uniform force. That's why, because there are a lot of limitation and health department is having a lot of other work, and the enforcement they are not giving much importance. But what I am always saying is that because we cannot say that because health department could not be in the enforcement, because 3,98,000 is 800 is one of the bigger amount for health department. What I am saying means is that because they have so much other work, they are not a uniform force. Then also they are doing some what enforcement it is work, because and moreover it helps other departments to do much more things. So that's why I'm not blaming health department, but the health department is conducting NDCP, and we are always saying that health is the nodal agency for tobacco control. But this paradox is there. Next one, sir. Then monitoring mechanism. Monitoring mechanism is a STCC, means the number of meeting, 2 STCC meeting in 2004 we had, state level, high level committee, high court, police. We have a high level committee in police department is managing, means the nodal agency as a nodal agency. But last year there was no meeting happened. Excise 2 high level meeting happened in state level. DTCC means 31 meeting in 14 districts. Means in 14 into 3 several meeting needs to be happen, but only 31 meeting in 14 district happen under NDCP DTCC. District monitoring committee, high court direction, police, only 4 meetings was conducted in that district level meeting under the police. Vimukti, we have a special mission is there, because our excise department is having a Vimukti mission. Vimukti in the sense all drugs are drugs control is the mission of this Vimukti. So they have a district level meeting. Kotpa is one of, but it is not getting much priority in Kotpa. Kotpa is not getting much priority in the district level meeting of Vimukti. Vimukti is organized by excise department, but then also 126 meetings are there district level. They are discussing mainly on hard drugs and alcohol. Kotpa is also getting some attention, but it's very minimum attention is getting in under this meeting. But then also we are talking about it's a school tobacco sale in the nearby school and that type of thing. And moreover, excise is doing a much better things, because of much better enforcement because of these meetings. 126 meeting they are having the district level. That's why excise is performing very well. Total 165 meetings in 2004. We had monitoring meetings. Then a major campaign in Kerala in the state is monitoring mechanism. TOFI, 31,700 schools are covered by TOFI. 150 colleges, 21 higher, only 2,500 schools were declared, 2 colleges, 1 higher education center was declared as tobacco TOFI declaration. Tobacco-free village. Actually, 16,150 villages are covering. I mean, village wards we are covering. Because in the sense, because Kerala, because one village means it's a very huge population, near about 28 to 30,000 population in each village. That's why we thought that, because the state level committee, what we thought is that we should take a village wards or village, and we are having activities in the ward level. So one ward of the local body we are considering as a village. So that's why 16,150 villages wards we are having, 660 municipal wards and 317 corporation wards are under the program. 7 wards only declared as tobacco free. Tobacco free neighborhood is a civil society activity. 3 corporation, 1,653 resident associations are there. This resident association is the responsible for each neighborhood should be declared as 256 neighborhood declared as tobacco free. Why we are going for the neighborhood is that because tobacco free village is not practical in the urban settings. Did you understand the point? I don't know. But anyway, as our experience, in the tobacco free village campaign may not be much effective in the urban settings. It's very difficult. So that's why in neighborhood, in the sense, the residents association is taking the charge of that neighborhood, and they will be the lead agency, means in the tobacco free activities, and they are reporting to the government and reporting to the enforcement officials that, because and moreover they are putting a board in their neighborhood is saying that because no advertisement is possible in the point of sale of neighborhood within this neighborhood, and no school with them, means all the schools in the neighborhood should be toffee declared. So these are the criteria we are using for the tobacco free neighborhood. It's a civil society activity. It's not a government activity, but it's a civil society activity, much effectively going on. Cheranallur, like Ernakulam district, some neighborhoods are showing a much better compliance than any other places, because the residents association is monitoring the matter. That's why it's getting a more civil society ownership to this program. So everyone means I invite everyone to comes to our neighbor, some of the neighborhood, and see the changes happening in that neighborhood regarding tobacco control activities. Tobacco free Ur is, that is the Ur means it's a tribal setting. We are calling it as a Ur, and 17 Ur are covering, but 9 Ur, but that is also means the NDCP activity also, because NDCP also involving in the Ur activity. Actually, KV just started, and NDCP taken over that things, and now the declaration and that type of part is taken by the NDCP. Tobacco free PDS, in the sense because we recently started the campaign at the public distribution system. Kerala is having a 14,000 public distribution outlets are there. But the problem with the public distribution system is that because that is a public place, people are coming there, but they are not having much license system. That's why health department is very difficult to enforce the signage and that type of things. It's very difficult. That's why now we are linked with the civil supplies corporation, means that department, and saying that because your outlets should be tobacco free. So this is the tobacco neighborhood campaign, and we have means all the smoke free points, means the toffee is there, tobacco free village campaign is there. All these things will be coming under the neighborhood campaign, because all the point of sale section 5 should be implemented in no advertisement in the neighborhood should be allowed. All the schools in the neighborhood should be toffee declared, like that, because all the public places of the neighborhood should be smoke free. Even flat and that type of system, because multi-level flat systems are in Ernakulam and that type of area. The flat should be having a smoke free signage and that type of things should be there. So this is our neighborhood. Some are the photographs. This is the photograph of training of police officers, because we have every year we are giving a training to SHOs of all the districts, because recently we completed Kollam, Alapi, Kottayam, Ernakulam district SHOs training was completed, because all the SHOs are attending our training. It's only 2 hour, 3 hour training section taken by police officers and health department jointly taking the section. But we in every year we are covering all the police officers under the training of CODPA, because new SHOs are joining. That's why these SHOs will be, some SHOs will be continuing in the next year also, but then also it is happening, and they are discussing their problems, issues, and how they will be supporting the education department. This type of a discussion will be happening in all the training programs. So, this is our district collector is with the children and other type of things only. Next one, sir. Nothing. So this is out of the box. We are going for the trophy, because you see, means the board means we are not stick on the section 6B board only. Our some of the schools are their whole wall is used for no smoking signage and that type of things. So this is happening in everywhere in Kerala. One of the best is, I think, because our trophy activities are going on, getting very good momentum. But we are not declare many schools as a trophy. Why it was happened is that because what we are thinking that by June 2025 we should declare a whole state as trophy state. So that's the activities going on in that direction. Next one, sir. This is our civil society leaders training. This is our civil society. All the district we have a partners. Our Pranay was the resource person in that program, and he took the training for all our resident association leaders, civil society leaders. All the district we have a civil society partners are there. My coalition is there. It's the out of that the leaders are joined together in the state level and they give the training. Very good watching system is there. This is our one of the civil society district level civil society meeting is there. So this is the meeting. Normally we conduct this meeting just before the DLCC. 1 day or 2 days before the DLCC, we have a civil society meeting and equip the partners to what are the questions raised in the DLCC, what are the demands we need to put forward in the DLCC, what are the new things we wanted to argue for tobacco control. That type of things we will be just before the DLCC we are having the tobacco free coalition meeting normally. So this practice is started from 2010 onwards. Still it is continuing. This is DLCC meetings, means as you know, means all the district level DLCC KVHS is as a member. That's why we are attending all the DLCC meeting. This is the human chain, means we conducted a human chain for tobacco control. It was a very big, I think near about a 2 kilometer we covered by the human chain. Police, excise and all department joined this human chain, and it was the Kerala High Court judge was also attended in the human chain. Why this IEC activity we conducted is that because it shows that our strength in the tobacco control. We have to, the civil society is having a capacity to organize a human chain. It shows our strength, means to the government, and not only the government, the enforcement officials and other department also, because we are able to, because means this is a very powerful pressure group. This type of IEC activity shows our strength that we are a very big power group and a power means a pressure group for the new policies and that type of things. So this is all the railway stations we covered with no smoking boards and that. Even our at present means recently means many people comes to Cochin Airport. They shows that because Cochin Airport is digitally digital signages. We already shows that signage is that because this is God's own country. You are entering to God's own country. The public places of this God's own country is smoke free, so don't smoke in public places. This message in all the railway stations we are going. This is the NSS students having means we are going for all the IEC activities like street play and that type of things. So thank you. My presentation is over.
Yeah. So thanks a lot, Sajuji.
Yes.
And you are doing a commendable job in Kerala, which is a very, densely populated, and the growth rate is as high as 3.31% against Government of India's growth rate as less than 1%. So it is really commendable. And in 15 to 64 years age group, 70% of the population uses tobacco. And female, they are increasing, and there's a lot of tobacco industry interference. Still, you are doing well. And you have shown the milestones during the 1987 to 2024. And it is impressive that MCR, it is included in the court power violations. They have been included in the monthly crime review. And you are conducting trainings in police. And 2013, there's monitoring court power enforcement is there. And a tobacco-free neighborhood is a good initiative, actually. So GATS 2, so because of your efforts, and GATS 2, close to 9% reduced prevalence was there. So, and it was second best to Bihar. So it is commendable, actually. If you want to say something, I would like to know how you enforce the law. I mean, how you conduct raids and seizures. So I think that is important for all of us to know.
Yeah, sir, we had a district level enforcement squad is there under the health department previously under the DLCC. We constituted a enforcement squad in all the districts. But sir, means practically it is not functioning very well in the sense means district level squad we will have some proceedings and means already we notified district level squad and block level squad. We have a block level squad also in the NDCP. But practically what is happening as many people says that because police is doing their enforcement because they are the routine activity they are doing. Excise is doing routine. In the health department, HI, health inspectors are doing, and JHI, junior health inspectors are doing their enforcement. But in a special cases in the sense sometimes we are getting a complaint from some places is saying that because this area means tobacco means public smoking is going on and that type of things. Then the health department immediately, because our enforcement squad procedure, what is saying that means we have a 12 officials notified in each district enforcement squad. But the order is saying that within this means among these 12 officials, 3 is sufficient for a squad. Sub squad is there. So our order is very clearly saying that not all should be present in the squad. It's not a must. All is good. All is well and good. But if 3 people are joined together and going for a squad, that is the enforcement squad. So sometimes
can you share some instances of raids on hookah bars and how you implement the PICA law?
Hookah is not that much familiar in Kerala, sir. Means it's coming out in Fort Kochi and that type of area. It is coming out. Hookah is not a familiar one in Kerala because means it's not a habit only, but it is coming up. Some hotels recently they already advertised that hookahs are available. That's why immediately the health department HI was inspected that area and that was means they will not go for that thing.
Oh, that is good. Oh, that is good. But still, I think you can. I think it is better to nip in the bud and you can use the existing laws. You don't have to have a court amendment for acting against the hookah bars. And what about PICA 2019?
PECA.
Yeah, PICA 2019.
Yeah, means PECA, sir, mainly we are Caesar was happen in the airport itself. Our means airport authority, because our this customs and that about the area, then much huge amount was taken up from the airport itself only. But we are not going for, means the police is having some cases, but we are not very effectively going for the PECA enforcement. But
So
that's one area.
the Director Revenue Intelligence is doing for you?
Pardon, sir?
Directorate of Revenue Intelligence, DRI, that is doing the raids under Customs Act.
We gave a training to our means this thing means GST wing, and actually because the smuggling and that type of area, we already given district level training for Ernakulam, Trivandrum and Calicut. Commercial tax department, we give a training. Actually, they are commercial tax. They are giving that inspectors, commercial tax inspectors, they already active in the PECA law also. But as a organized way, we didn't go for the PECA enforcement still, because it's a blanket ban. That's why some news are coming out from police is seizure some, but it is not much prevalent. It's only very hidden sale is happening. Very hidden sale is happening. So that's why it's not a very visible sale happening in anywhere in Kerala.
So, Sanjuji, are you doing anything to control the online sale of cigarettes, or even now oral nicotine pouches are available? And what about the e-cigarettes? Are you doing something about online sales?
Online sales are available here, sir. Online sales are there, but the problem is that the user is getting it. Yeah? The user is getting it, and because we don't have much cases reported here, means owners are the retail seller. They are not.
Sushma ji, can you please keep yourself muted? Sushma Gurang, please. Yeah, thank you. Yeah. Yes, Saju.
Yeah. So we are not getting much complaints regarding this thing, because online sale is there. Online sale, online this thing in the online sale is there. But many of that online sale is for the user is demanding for the this thing, and that type of things is happening. The whole bulk is reporting there much, sir.
So, Sajji, I may suggest that you can use your cybercrime wing of the police department to, to keep a check on online sales. And moreover, you can send your complaint to the government portal, Government of India portal, regarding the online sales.
That's a good suggestion, sir.
Yeah, Sushma, can you please keep yourself muted? Sushma Gura? Can you please? Can we do it? I'll try to do it. Yeah. Because. Just wait for a minute, Guru. Yeah. Okay. Yeah, thank you.
Oh, don't worry.
Yeah, do you have
a suggestion? Only thing is that we are not much effectively implement the PECA and that type of things. In the sense, means very visible retail sale is not visible here. Only in Matanjeri, some Cochin area, some area that is there. I totally agree with that thing. Means we recently.
I was just letting you know that you can do it, because you are doing such a wonderful work in Kerala. So you can add to this, add to your work. So, and it is not difficult to do actually, because even if the cybercrime wing sends a notice to them,
yeah,
awareness notice, even that is enough.
yeah, okay.
Yeah.
Thank you, sir.
So the forum is open for any questions from Mr. Saju. So anybody, they can just make themselves unmuted and ask questions directly. Yeah. And we have Dr. Siddhi Atiwala, Sherko Hamad, and staff from Faith Foundation with us. So you're welcome. All of you are welcome. So
Hello,
any
sir.
questions?
Susan here.
Yeah.
Not
Yes,
a
Susan.
question, but I wanted to appreciate and congratulate Saju sir for the presentation. I could attend a part of it because I was traveling, and I believe I just wanted to reiterate the fact that Kerala has always been a path bearer to for us to follow. You know, in tobacco control, in various initiatives that Kerala has always taken. You know, and obviously under Saju sir's organization and his initiatives also. Especially, I remember the Yellow Line campaign we started was after we saw it being done in Kerala and stuff like that, and then obviously in West Bengal also and stuff like that. But when we were there this time for the Kochi partners meet also, and even earlier when I have visited Kerala, I have distinctly seen that, you know, it's not like in Gujarat or any of the north states that they typically have, you know, shop, you know, or a pan shop or something like that. So that was very unique, and you do not see any ads being put up or products being, you know, flamboyantly showed, you know, in terms of the sachets of tobacco products and stuff like that. So that is very distinctive, which I noticed last time also in my visit, and I would only want to share how it makes a difference, you know, that when you are working pro on a particular law or particular act. So Kodwa in its truest sense seems to be implemented in Kerala in various ways, and specifically when it comes to protecting children and, you know, kind of curbing the accessibility and availability of the products to the children especially. So yeah, Saju sir, thank you so much for kind of, you know, giving us these examples, you know, and giving us these views which can be very different state wise, and that makes sense, you know, if you can implement it in our state also. So thank you so much.
Yeah, thank you, Susan, for your comments. And I told him about the DRI.
Right. I just heard that.
You're using that very effectively, the Directorate of Revenue Intelligence, as far as the Customs Act is concerned. I think that is commendable.
And even if it is through the Home Ministry, meaning the SOG police, Special Operation Groups can be very effective, the local police and stuff.
So we always learn from each other actually. Some things they are doing good, some things you are doing good. So that is why this series of webinars is being done, so that we learn from each other. Yeah, thanks a lot.
Thank you.
So Haresh, Dr. Haresh, are you with us for your concluding remarks? So you're muted.
Yeah, sir. Yeah. So thank you so much, sir, and thank you, Saju sir. It was a wonderful session, excellent session. As sir said, uh, we learned from each other so many good practices that you have shared, and I also learned because so many new things. And so thank you. It has been a wonderful session, and I just hope that whatever learning takeaway from this session and whatever past sessions, upcoming sessions, we need to actually implement on the ground and share the experiences, share the challenges on the ground, share the best practices, so that it can be replicated by the other partners. So, you know, in ECHO also, because I'm working with ECHO India, so ECHO stands for Extension of Community Healthcare Outcomes, and the one of the core principles of ECHO is sharing best practices, isn't it? So that's how during our session, you know, our experts, participants, they share their best practices, their experiences, so that you know, it's a peer-to-peer learning. So we are trying to create all teach all in kind of environment. So I think with that principle only, all our partners who are associated with ECHO India, So they are doing the same thing. So I'm very happy. I'm very glad that today I got this opportunity to be part of this initiative, and I learned a lot from this session. And I hope all the participants have the similar, the feedback. So thank you so much once again, Saju sir, Dr. Rakesh Gupta sir. Thank you so much for giving this opportunity, and thank you for organizing such wonderful sessions. Thank you.
Thank you, Dr. Haresh. And you'll be pleased to know that we have some international participants also, and they are also trying to learn from India, from some of the Indian states.
That's quite
So,
incredible. Thank you, sir. Great.
so if there are no more questions, I think we can shift over to a formal vote of thanks by Dr. Tamanna, by Ms. Tamanna actually. Yes, Tamanna ji.
Thank you. Thank you, sir.
Thank you, Haresh, and thank you, Saju,
Thank you, Chandwan
for
ji.
joining us, and thank you all the participants. Thank
Thank
you.
you, everyone. Thank you so much.
Okay.